Hello, everyone. This is Atul Verma. I'm a clinical psychologist from Unique Institute of Behavioral Sciences, and now we'll discuss about drug de-addiction counseling. So, the today's topic is the management. Okay, how we manage substance use disorder, or we can call it a drug addiction, whatever you are comfortable with. So, the thing is, as we have already discussed in many um, videos, that जो substance use disorder or drug addiction or alcohol addiction is a biopsychosocial problem. Biological problem means uh, they have a number of like biological problems related to different organs like liver, kidney, and other things, and as well as they have psychological issues also. There may be comorbidity like depression, anxiety, schizophrenia, delusional disorder, and many more things. And there are mm, problems related to cognitive functionings, because all the drugs or alcohol, they affect your cognitive functioning like decision making, problem solving, all those things. And other thing is the social condition like your relationships with your family members, your job, and other legal issues. There are a number of things uh, related to that. So the management must be cater all these things, biological things and the social things and the psychological issues. So we require a comprehensive management plan for these drug addicts or alcohol addicts. So when we talk about comprehensive management, so this will cater all three things: biological, psychological, and the social. So, and lifestyle managements, issues related to motivation to leave the drug or alcohol, and developing skills or coping skills, you call it, and reducing risk taking behavior, because they are also involved in that, like rash driving, unprotected sex, and there are n number of things, risky behaviors they are involved with, and developing coping skills, because sometimes they are impulsive, they are aggressive, they are not able to deal with the situations they have. Sometimes they have comorbidity like anxiety and depression, already I have discussed. And there are main problem is there related to relapse. So how we will manage the relapse, because after taking admissions, when they take treatment and they go out and then again they get relapse, these are the problems we face. So depending on the issue, like it is a biological and psychological and social issues, to management, as I said, will be like that only. To psychological treatment modalities we use, and biological modalities we use, and a sociocultural model treatment modalities we use. So, but as a psychologist, we are now focusing only on the psychological treatment modalities. So, psychological treatment modalities are like different kind of psychological counseling and all. So now what I am going to tell you is the guideline, like principal guidelines for effective interventions. So there are few guidelines that we are discussing right now. Number one is no single treatment is effective for all individuals. So we have to understand there may be like number of treatments, but all the treatments are not related or effective to each client. Means one single treatment cannot be uh, good for everyone, that we have to understand. So it should be gender specific, culture specific, and it is geared towards the addressing the individualized need of the patients, because each individual needs different kind of attention. And the second thing is the treatment must be readily available. Sometimes it has been seen that the treatment is not available readily, and the person has to wait or has to travel a good um, number of kilometers to reach the treatment. So that is not a good thing, because if the treatment is readily available, then the chances for the treatment increases, and the improvement chances for the improvement is also increase. Treatment to be effective should attend to the multiple needs of the patients and include case management services. As we know, they have lot of problems in different areas of life, like psychological problem, medical problem, legal problem, all kind of problem they may have. So we have to deal comprehensively with all these problems when you are dealing with the client. So we have to manage all those things also, and we have to take care of all these things. So that is another thing. And it has been seen that counseling and behavioral treatment with other like biological and social treatment is must for the treatment, because uh, medicines and everything, they will help you in medical conditions, and they will help you in withdrawal symptoms, but cannot change your personality, they cannot change your thinking process, they cannot evaluate or make decision for you. So for that, the counseling is required with professionals, so that you can understand the client, and the client can understand oneself, and take actions according to that, because some of them may be, as I said, maybe impulsive, some of them are aggressive, some of them may have depression, or some many other things, so that we have to understand. So counseling becomes very important treatment modality when we are talking about the management of drug or alcohol addictions. So pharmacological intervention is also important, and it has been seen that when pharmacological treatment is provided with the psychological treatment, it becomes more effective, and overall treatment become more effective. And to be successful, treatment must address aspects of the patient's post treatment environment. As I said, it is there is a multiple time there are relapse in these kind of cases. So to prevent the relapses, post treatment management becomes very important. We call it follow up and relapse prevention. So family counseling, follow up, and relapse prevention becomes more important when it comes to post treatment environment, and post treatment attention to the client. And next and one is that patient's progress in the treatment should be closely monitored. So we have to monitor the progress of the client, and if changes are required, we have to change the plan or modify our plan for the treatment. That help us to uh, like mm, uh, change the program according to our client, and that is a good thing, and that will be more effective. Now we are coming to other point, that is treatment does not need to be voluntary and to be effective. So patients who enter treatment out of coercion and fear fare equally well in the terms of outcome. So it has been seen that the person who are coming voluntary or involuntary, treatment is effective uh, in both the cases similarly. So that we can see, it is not necessary the person comes voluntary or involuntary, treatment will be effective in both the cases equally. It has been seen. And other thing is that has been seen that the longer the treatment, better the outcome. So if the person is taking treatment for 1 month, 2 months, or 3 months, so 3 months, the person who is taking the treatment for the 3 months have better chances to recover. And last thing is, treatment to be effective should be flexible and strive for quality improvement. So treatment should be effective, and quality, we have to focus the quality of the treatment also. So that is very important. Another thing that we have to very careful about is complete abstinence from the substance use is a long-term process and may require multiple episodes of the treatment. It is not like only one time treatment will be effective. Sometimes it may be effective, but sometimes there are relapses, then again the treatment, and then again relapse and treatment. That is the part and parcel of the treatment. So we have to accept this, and we have to work on that. When someone is relapsing, we have to take care of why it is happening, what is the like problem, what is the cause behind that, we have to evaluate it and we have to work on that. So that is the process for the treatment. And other thing is, when it comes to, there are a lot of challenges faced by the psychologist or counselor when dealing with this kind of issues. So number one is like poor treatment retention, because as we know, the choice of taking treatment remains with the client. So they want to take the client, they want to take the treatment or not, that is entirely dependent on the family members and the client. So usually it has been seen that the motivation of the client uh, is low, because in initial stages they are in denial mode. So it becomes very difficult to retain the client, and when we cannot retain the client, it becomes difficult to treat them. So that is one challenge, and another challenge is efficacy linked the patient's characteristics, because if the your client is like highly educated or educated well, or belongs to higher socioeconomic status, and have good social support and low severity of drinking or taking drug, then there are higher chances to improvement in comparison to the person who are less educated, belongs to low socioeconomic status, as well as they have a low social support and financial status. So other thing is personal characteristics of the counselor also is very important, counselor or therapist. So the counselor who is very empathetic and have good interpersonal skills, and they have more chances to get good rapport with the client, and that may convert into good results. And other thing is matching the treatment expectation. So it is it should be understood that um, like we should understand that each treatment will not work with everyone equally. So, and one thing, other thing is, each client will not respond to treatment in a similar way, because they are different, each client is different. So that we have to understand, and then similarly, the expectations from the treatment uh, may be different with different clients and the family members. So we have to address that also. So when you are having client or family members, they have certain expectations when they are coming to you, and they have certain expectations from the treatment. So we have to match that expectation with the treatment. So we have to tell them, and we should discuss with them what they can expect, what they cannot expect, what is the role of family, what is the role of the client. So that we have to tell them very clearly, mm, for the smooth or treatment of the client. So today we have discussed the different modalities of the treatment, specifically the psychological modalities of the treatment, and challenges faced by the psychologist or overall professionals when we are dealing with the client. Hope this video will help you to understand these concepts, and uh, if you want more uh, information or training on this aspect, like de-addiction counseling, you can visit our website. The link is given in the description box. You can also join our course to learn more about, and if you want more videos on different topics, please let us know by commenting on the video. To encourage us to make more videos on psychology topics, please like and subscribe our